From listening devices that detect falls to patient sitter systems in hospitals and robots helping with exercise in care homes, Singapore is looking to artificial intelligence to help manage the health of its elderly population. By 2030, a quarter of Singaporeans will be 65 or older. In 2010, the figure was 1 in 10, and it's estimated that around 6,000 nurses and care staff will need to be hired annually to meet Singapore's health workforce targets. Technology is much needed to help fill the care gap in Singapore and elsewhere, according to Xuan De Fu, a research fellow at Singapore's Saw Swee Hock School of Public Health. Societies around the world are dismally unprepared for an aging population, Fu wrote in the science journal Frontiers last month, and with his co-authors described AI and other technologies as pivotal forces with the potential to drive a paradigm shift in healthcare. For Fu, artificial intelligence is set to play a huge role in elderly care in Singapore, both in terms of helping clinicians manage non-acute conditions and in overseeing administrative tasks such as monitoring the availability of hospital beds, he said in an email to CNBC. As the elderly in Singapore get more IT savvy, we see them turning to teleconsultations and digital tools that utilize AI technology, he said. AI is also being used to detect diseases earlier, an area of personal interest for Dr. Han A. Chew, a research fellow at the Lee Kuan Yew School of Public Policy in Singapore. He said his late mother's diabetic eye disease could have been diagnosed and treated earlier had AI testing methods been available when she was alive, as they are now. That would have been so useful when the family was going through that journey, Chew told CNBC by phone. A big focus for Singapore is aging in place, according to Chew. We can deploy the AI, but it isn't about fully replacing human care. It is really about assisting the caregivers and helping seniors to stay independent and age in place, he told CNBC via video call. Chew said Singapore's Housing and Development Board is even offering built-in home technology to detect when someone falls down, with an alert sent to a resident's next of kin or connected to a call center for help. These types of monitoring technology need to be used carefully, Chew said, in whatever jurisdiction they are deployed. The AI should empower the seniors and not strip them of control. They still need to have the choice to opt in, set boundaries, and, more importantly, to turn it off when they want, he told CNBC.